At this point, I'd like to call on someone who has been working very hard behind the scene and who has been doing a lot and who I know is very happy to see that we have come to a day like this. Is no other person than Dr. Donald Imosemi, who is going to give us a brief about the journey so far. Please, let's put our hands together for him as he comes to the microphone.
Thank you very much. The Honorable Commissioner of Health and the Chief Host of today's event, Dr. Jide Idris, distinguished members of the High Table who have been individually introduced much earlier, distinguished members of the Association of Fertility and Association of Fertility and Reproductive Health, including the trailblazers, Professor Giwa Osaga and Professor Ashiro, distinguished invited guests, members of the press. And once again, I'm Dr. Imosemi. The journey officially started in December 2013, when the ministry thought it wise to constitute a committee, then led by Professor Wale Alakija, to do a literature and text review, not just on IVF, but on advanced medical procedures and research, and develop recommendations on policy, regulation, and ethics. In 2012, there were some landmark events that probably triggered off the ministry. One, the ESHRE, European Society of Human Reproduction and Embryology, then made a landmark announcement, which was the fact that in that year there were about 5 million babies that had been delivered via the IVF, and all the various concerns about the health of these babies were doused as they were just like any other baby, healthy without any lingering health problem. 5 million, that was significant. Lagos State had just become a mega city, with 10 million persons. And in such a state where you have about 10 to 50% of, the reproductive members being at risk of having infertility issues and all that, that would translate into a huge number. And yet, in Lagos State, as of that time, and in fact in the country as a whole, there was nothing to regulate the practice. So, huge number of people with the potentials to embrace this practice, and yet there was no regulation in place. The number of the IVF unit had begun to climb. In 1999, there were just about 4 in Lagos and Abuja, but by the 2000 and above, the number had begun to go up. And then Lagos always wants to, match global best in terms of policies and practice. And so Lagos still had to swing into action. By 2014, some of these recommendations came out, and these were reviewed by various bodies that were set up subsequently. Fast forward to about 2017 or thereabout, there were some landmark events again that pushed the ministry. There was now incontrovertible evidence that there were some, infiltrators, as it were, charlatans. Quackery was beginning to go up, and where there was no law, no regulation, you could hardly, criminalize activities, and that ratcheted up, heightened the tempo. And that's where some of us came in behind the scene, to work with others to make this happen. There was massive, periodic, consultation with stakeholders to ensure that consensus was built on a number of issues. ART is very topical, with issues bordering on ethics, culture, religion, and other coming in. And in a society like ours, there was a need to address that. Again, AFRH Lagos State became even more visible, and in-house, a lot of work was done to ensure that, again, a lot of things were done to build consensus. So the onus was now on us at the ministry to interface with them regularly, dot all the I's, cross all the T's, and make progress. And we are here today on the 6th of May 2019 to witness the birth of a policy document that at the end of the day should, going forward, because it's a journey, going forward, should help guide the practice, improve regulation, help in the process of enforcement, monitoring, and accreditation. So that at the end of the day, practice will be a lot better, and the good people of Lagos State will be better for it. So on this note, that's the journey so far. But like I said, we've just begun, and I do hope that going forward, things can only be better. Thank you very much.
It said the journey has just started. I believe that we'll get to the destination of excellence by the help and assistance of all of us that are here present this morning. At this point, I want to start taking the goodwill messages. And the first person to speak is the immediate past president of the association, the person of Dr. Faye Iketsubosi. Please, let's put our hands together for him.
The Honorable Commissioner of Health, permit me to stand on protocols already established by Dr. Mosemi. An ancient Chinese philosopher, Lao Tzu, said, and I quote, "The journey of 1,000 miles begins with one step." And that step has started. In Lagos State has always been the trailblazer for healthcare and many other innovations in Nigeria. And this journey started out of joint concern between us, practitioners within the Association for Fertility and Reproductive Health, and the Commissioner for Health over the practice of ART in Lagos State at the time. The practice was totally unregulated, and there had been a number of near misses, and we had great concerns for the health of women in the state. And it was easy working with the Honorable Commissioner because he's always has shown himself to be a forward-thinking man, a man of principle, and a very high ethical standards himself. And as such, we were able to work together for 5 years. It took a long time, painstaking perseverance and focus, really, to be able to get this document together. As Dr. Mosemi said, the AFRH worked with Lagos State because Lagos State already had a document. And what we did was to look at our document and look at theirs and marry the two. And at the end of the day, we were able to put it across to stakeholders who are all practitioners in the state. We had a meeting in this very hotel in August last year, where we invited stakeholders within the state to discuss the document. And after that discussion, we still went back and tweaked it a bit more to be a bit more inclusive and to make it more representative. There are a number of burning issues which we needed to thrash out. And one of the ways we had to deal with that is to ensure that everybody who practices within ART, within the state, should be registered with the government, with the state government. And that every practitioner or every practice should conform to a minimum standard. Minimum standards in terms of personnel, minimum standards in terms of equipment, minimum standards in terms of the overall understanding of the practice of ART. And so the document categorizes clinics into 3 levels, so that everybody who has an interest and an appropriate qualification in ART has a place to fit in. This is an inclusive document. It's not supposed to be, it's not in any way meant to be penalty driven, but is to try and galvanize all practitioners to be on the same page, so that the women for whom we are here to serve get the best out of us. And so we've also, along that line, instituted what we call the registry, the AFRH registry. And this serves several purposes. One, it is to help us to evaluate the safety of ART. How well are we doing? What is our success rate compared to global standards? What is our complication rate? How do we deal with that? And if we don't collect data, we shall not have this information. And so the AFRH registry was born, again, after several years, or it took about 3 years to be able to get it up and running. And the Lagos State government has bought into the idea of the registry because the government also needs to have data on the number of cycles, for example, that are being done in the state, what kind of success rates we're getting, and what are the demographics of people that access ART care in the state. So it turns out to be a win-win situation between the AFRH and the Lagos State government. And so, so it gives me great pleasure today to be part of this process. And like Dr. Mosimi has said, the journey has just begun. This is not the end. This is just the beginning. And as Lagos has led the way in many other aspects of human endeavor, we trust and believe that in the non-too-distant future, the rest of the country will follow this lead. And the practice of ART will become safer for our women, and we shall be able to walk proudly within the global committee of nations that, yes, that is something good has come out of Nigeria. Thank you very much.
Thank you very much, sir. At this point, I want to call on Dr. Abiola Idowu, the Acting Executive Secretary of Health Facility Monitoring and Accreditation Agency in Lagos State, to give her remarks. You can clap, please. She's a woman, and this is all about women, too.
Okay, thank you. First and foremost, we want to appreciate and thank the leadership of the ministry for championing the birthing of the process of bringing standards into the art practice, because if there are no standards, we cannot regulate. So we really thank you, sir and ma'am, for this process. We also want to reiterate, because Dr. Iketubosun has done my job in spelling out the dimensions of the standards, so I won't go over it again. But we want to reiterate that for any facility providing art services must register with a farmer. And we have these guidelines that we're launching today that we must all comply with. Thank you very much.
Thank you very much, Dr. Idowu. Now we have to listen as I bring to the microphone Dr. Ibrahim Wada, OON, the President of AFRH. Let's clap for him. Something good has started happening in his tenure. Thank you, sir.
Thank you, and good morning all. The Honorable Commissioner for Health and our chief host, Dr. Olajide Idris, esteemed members of the high table who are with me here. It's a great day today, the because I think this is the very first time in Nigeria that people are gathered to unveil guidelines and regulations for practice of any branch of medicine. So I think before I go into too much talk, I want us to give a round of applause to the people who have made it possible. On that note too, I want to personally and particularly appreciate the presence of two great Nigerians without whom this day would not have ever been thought of. And who do I mean? But your own very professors, Giwa Osage and Oladapo Ashiri. The country is grateful to you for the pioneering work, and I'm grateful to God that you are here to witness that work carry on by very young people and the involvement of governments to make things happen. So well done to you, and God bless you. It's not easy for government to work with non-governmental organizations and win, but we are seeing an example today. Because generally when you say anything government, you keep waiting forever and you get nothing. It is on this note that I bow, sir, to you, because the leadership you have provided from a governmental side, it became so easy to say it can be done. And I also bow to say to you, from the non-governmental side, Dr. Faye Ketibosun, these are the two pillars that have worked tirelessly to make this document a reality. I'm personally grateful, and the AFRH is also grateful that we've got to this point. We owe you a duty, both of you, to not let it stop in Lagos State. Where are we going next? Once we've seen how it settles in Lagos, our focus is on the Federal Capital Territory next, and after that, the River State. And I want to assure you that in the fullness of time, every length and breadth of Nigeria will have something to learn and benefit from this great document. So once again, well done, and thanks to you all. I think we should give them another round of applause. What's in this book, in a few words? It is but a guide to patients to know where to go and what to expect from where they go. It is also but a guide to practitioners to know what they should be doing in the first place. And it is thirdly a sanctions document only for those who know what to do, how to do it, but persistently say they won't do the right thing. So these are the few words to describe what I see as the content of this document, which will endure and it will survive. And on that note, finally, I want to commend everyone who's taking time out of their very busy, tight schedules to come and bear witness to a momentous and historic occasion, not only for Lagos State, sirs, and Mass, but for the country at large. God bless you.
Please, we can clap once again. Thank you very much, sir. Distinguished ladies and gentlemen, at this point in time, I will humbly request, maybe apart from the pioneers and trailblazers that are in our midst, that we give a standing ovation to the Honorable Commissioner for Health in Lagos State, Dr. Jide Idris. Thank you very much. I know that the Lord will honor all of us too at our own time. I like to say a lot of things about him, but I'm not permitted. This is someone who has brought a lot of reforms a lot of changes, a lot of progress to the health sector, not only in Lagos State, but in Nigeria. I'd like to bring him to the microphone to perform the launch of the document. He won't allow me to talk. Thank you very much, sir.
They taught me in College of Medicine. Professor Gewa Asagi and Professor Ashiru. And I say, Professor Gewa Asagi, I say Floriad. Mr. President, I say distinguished colleagues, everything has been said. My job is to launch this book. But I just say a few things that, from perspective of the role of government, if you recollect the year 2004, thereabouts, we started a reform agenda in Lagos State. One of the things we said we wanted to do was to create a regulatory capacity for the state. And at the same time, again, partner with the private sector, because government cannot do it all alone. And it's been a tough journey. In the process, we created a farmer. And we are still recreating a farmer because recently a farmer had to be retooled. But given you the history of what we're here to do today, but my take is that the landscape of healthcare is changing every day. And as Nigerians, we must not be left behind. And globally, people look at the issue of professionalism, they talk of the issue of quality, they're talking of the issue of ethics. All these things are ingrained in what we're here to do today, assisted reproductive technology. These guidelines may, in the next couple of years, they become obsolete because of development in science. So I think periodically too, they need to be reviewed in the context of what we are doing. But the essence is that our role as government should be more of governance and leadership. But we have so many things. In Lagos, I'm not even sure we have maybe very few in government expertise like this, very few of them. But the private sector has many. Like Professor Dr. Imosemi said, we're not even looking at ART, we are looking at advanced, because as we go along, talking of the age of genomics and all these things will continue to change, they're all linked. So there's a need for us to regulate the practice, more so in the context of what we have been observing. I've had calls to send people to go and shut down some clinics in Lagos State. I always remember that one of them moved out of Lagos and went to Ogun State. And I called the commissioner of Ogun State, so the practice said, go and deal with the man. And he showed me the pictures of shutting him down. So that's some cooperation. But the essence is that we need to put some sanity into the system. At the end of the day, if that is not done, all of us will be affected. And we hold responsible. So on that note, I think we should be happy with ourselves, at least that we're doing this today. But like I said, this is just the beginning. So in short, I'll just say, I congratulate AFRH for partnering with Lagos State. I congratulate members of the HRH for supporting this document. And I want to say it's my honor and privilege to launch these regulations and guidelines for ART practice in Lagos State. Thank you very much.
Thank you very much, sir. It's a Monday morning, so we make this to be very brief. I'd like to invite Dr. Abiola Adewusi, the Secretary General of AFRH, to give us the closing remarks. Another round of applause.
Thank you very much, Mom. Thank you very much. I would like to stand on the existing protocol. On a lighter note, I think that I would like to express the fact that I'm very, very happy and honored to be part of this process. It's been a long 5-year journey, And I would like to say a very big thank you to the Honorable Commissioner for Health. Each time we go to his office, he's always pulling out all these big files to make sure that things are done properly. This small document that we're looking at is, it's been a long road, just so you know. It's never been easy. We try to track down the commissioner anywhere we can track him down to move this document forward, and he knows what I'm talking about. So everything has been said today. I'm not going to belabor the issue. It's been established. We're happy to be here, and this is the beginning, like it has been stated. We're looking forward to working with EFAMA. The EFAMA team has also been very, very wonderful. HC calling them all the time and say, where's that document and all that, and they're always pulling up this document here and there. Thank you very much for all your hard work, and thank you for the members of the High Table, and the members of EFRH and the members of the press. Thank you very much for making history, and we hope the rest of the state in Nigeria will take a cue from this. Thank you.
We actually have a vote of thanks, which I think Dr. Iwusi has done a bit of. But at the same time, since we have it on the agenda, I'd like to call on the Permanent Secretary of the Ministry of Health, Dr. Titilayo Gonzalez, to move the vote of thanks on behalf of all of us. Thank you very much. Please clap. You can move on.
Morning, everyone. The Honorable Commissioner for Health, Dr. Jide Idris, my boss, the President, Association for Fertility and Reproductive Health, Dr. Ibrahim Wada, my two EMOs, Professor Ashiru, Professor Giwa Osage, the immediate past President, Association for Fertility and Reproductive Health, my classmate, Dr. Faye Ketibosin, gentlemen of the press, ladies and gentlemen. It is my pleasure to move the vote of thanks today on behalf of this association, because I know that you have put in a lot of tireless work to make this happen today. All over the world, standards are established, and I'm happy to note that you are making this possible in Lagos State. You are giving a lot of women hope, women who might have fallen into the hands of quacks and had their wombs destroyed or messed up. And now they have a guideline, a directory, and also regulations that will direct them to where to get adequate and proper care. And this could not have been done, of course, without the synergy of our government, the HEFEMA team, who have worked tirelessly to register the people who are qualified to carry out this work. And I believe that this synergy will continue between the Lagos State government and the Association of Fertility and Reproductive Health. But what you need to know that what you have done is very commendable, and the result of all this work is more hard work. And so we know that Lagos State can be guaranteed that the reproductive Association of Fertility and Reproductive Health will live up to their standard. And so we are ready at any time you call on us in any way we can assist. We just want to let you know that we are there for you. So as we leave this place today, we pray that you'll go all safely back to your destinations. Thank you all very much.